Have you ever said, that doesn't make any sense to me? You know, right now I'm doing something that I never do. I'm looking for a roof on my house. I'm looking to get it done by the right person, and so we're going through the process of finding out different kinds of roofs, metal roofs, shingle roof, durability of roof, how long the roof will last. I don't know that stuff. And so we've had a number of different contractors come out, and they just present material to us so that we have an idea as to where we want to go and who we want to do it with. Okay, so we've looked at 4 different contractors for a roof, and that's a major decision for us. Now let me ask you a question. Do you do the same thing for your health care? If there's a major decision to be made, do you think about it, work with it, get other opinions before you make that decision? And I've got to tell you, for most of you, you don't. Particularly when it's paid for by insurance. Because you'll hear the opinion, find out if it's paid for, and then you say, okay, then as long as it's paid for, I'll do it. Right? Okay? Some of you are saying yes, some of you are saying no. So to those of you who are saying yes, let me tell you this. I don't care whether it's dental, medical, or any other aspect of health care. There are different diagnoses, there are different ways of arriving at a diagnosis, and there's a certain amount of thinking that needs to be done in order to arrive at that diagnosis. We'd like to think that it's totally objective, but you know, very often it's not. We can take the same problem, that same problem can be addressed in a number of different ways. And it may be that the first way that you've heard about is the best way of going, but it also may be that it's not, and that it's not the best way for you. And that if you're able to get another opinion or 2 opinions, excuse me, you'd have more education on the subject, and therefore you'd have a better idea as to how to go and what to do. You know, in dentistry, whether you're being seen, if you're being seen by a general dentist, there are general dentists, for example, who treat periodontal disease. But you know, a person might come to me and I may decide, I might recommend that periodontal disease be treated a little bit differently, maybe more aggressively. Very often, by the way, less aggressively, particularly with the instrumentation that we have here. But let's not limit it to me, and let's not talk about me. Let's look at about any aspect of your dental care. There are specialists in each aspect of dentistry who will specialize in anything that you have done. I wrote about it in Florida Today. If it's root canals, there's the endodontist. If it's complex crown and bridge work or partial dentures, there's the prosthodontist. If we're talking about major surgery of the jaw or even dental implants, there's the oral surgeon. And of course, periodontists do implants too. If you have children's dentistry issues, there's the pediodontist or the oral pediatrician. And if you're straightening your teeth, well, there's the orthodontist. All of them are there, and all of them have been trained well beyond dental school in order to be able to provide the best possible and most highly trained way of treating and looking at things. Now, I'm not saying that every problem needs to be treated by a specialist. It doesn't. But if you have some idea that there's a question, or if you want to verify what one dentist has said, certainly there are specialists in dentistry who you could see to verify, and then you can make the decision, because I guarantee you there'll be a little different nuance no matter who you see. So what's the message here? If there are complexities in your care, or if you say, gee, I really have some questions about that, and I'm not sure I'm getting all the answers I need, well, there's a specialist in every area, whether it's dentistry or medicine, who can help you with that. Any questions? Just give me a call.